Welcome back to the TMDSAS podcast, where we'll explore the TMDSAS application in greater detail by connecting you, the applicant, with the admissions experts who are ready to help. I'm your host, Enrique Hasso, Coordinator of Research, Advising Services, and Digital Media at the Texas Health Education Service in the TMDSAS office in Austin, Texas. Today, we are very fortunate to be joined by several people at the Texas A&amp College of Veterinary Medicine. Dr. Alice Blue McClendon, she is the Clinical Associate Veterinarian at the Veterinary Physiology and Pharmacology Department. We have Yolanda Brinkman, the Admissions Coordinator, and Dr. Gwen Levine, Clinical Associate Professor, Department of Veterinary Pathobiology. Thank you all very much for joining us today. All right, well, let's go ahead and get started with several questions that we have for you. And as we know, you are the only veterinary school in Texas, and we're very happy to have you as part of TMDSAS. And so, unfortunately, that also means that all of the questions that we've been able to share with all of the medical and dental schools, we're essentially going to have to answer all of those questions for veterinary applicants in this episode. Let's go ahead and get started to get to know each of you a little bit more. Would you all mind sharing your academic background?
Yeah, this is Alice Blue McClendon. I received my bachelor's degree in biomedical science from Texas A&M University, my bachelor in veterinary science from same university, and then I got my DVM from Texas A&M College of Veterinary Medicine in 1989. And then I did a 3-year clinical residency in zoological medicine here at the teaching hospital, and I have stayed here ever since.
This is Gwen Levine, and I have a bachelor's degree in biology from Cornell University, and then I came to Texas A&M to complete my DVM and graduated in 2006. And then I was able to stay on and do a 1-year rotating internship in small animal clinical sciences, and then a residency in clinical pathology, and I've been on the faculty ever since.
Fantastic.
And I'm Yolanda Brinkman. I'm the admissions coordinator. I've been here with the College of Veterinary Medicine for over 20 years.
That's quite a bit of experience just in that room. So we're very thankful to have you all sharing some of your thoughts on where applicants can actually get a leg up on the competition for this next cycle. So moving on to our next question, would you all mind sharing the work experience that you have that's led up to you being in this role at the College of Veterinary Medicine?
Okay, this is Dr. Blue McClendon. I have been on the selections committee for about 6 or 7 years, and I have a real passion for the admissions, or as we call it, our selections committee. I've learned a lot from different people that have come before me, from different members of the committee, and from Yolanda in the admissions office.
And this is Dr. Gwen Levine, and I've sat on the selections committee for approximately 3 years. And I've learned a lot from Dr. Blue McClendon and others on the committee. We have some members who have been on there for almost 20 years.
I've been in this position, again, as I said, for over 20 years. I've gained a tremendous amount of knowledge by sitting on this committee with these great doctors, learning about the admissions process and helping students achieve their goal of becoming doctors of veterinary medicine. So, I just have enjoyed my time here and working with these great people.
Wonderful. We have many applicants who have several choices in their veterinary school. So could you please tell us what actually drew you to the Texas A&M College of Veterinary Medicine?
Well, for me, it's because I'm a Texas resident, and so it made perfect sense that I would go to my in-state school.
This is Dr. Gwen Levine. So I'm actually originally from Connecticut, which is a state that does not have a vet school, nor does it have contracted seats at any of the vet schools in that area. So when I wanted to become a veterinarian, I applied to 8 different schools, and I was lucky enough to gain admission at Texas A&M. And I really, the curriculum here with the emphasis on early hands-on experience is what really attracted me to this school. And Texas A&M just has an amazing reputation as a college of veterinary medicine. So it was worth the trip down here.
Well, as we mentioned, we've spoken to several other schools at this point, but being the only veterinary school, we'd like to ask you a little bit about what veterinary curriculum looks like. And if you all are doing anything different at your school, would you mind walking us through what the curriculum looks like?
Once students gained admission to veterinary college, it's a 4-year curriculum. The first 3 years are primarily spent in the classroom and laboratory with some clinical time. And then when students are in their fourth year, they spend 12 months in our teaching hospital in both the large animal hospital and the small animal hospital. The students, as far as classes goes, first year the students, I'd say they take about 20 to 21 credit hours of class and lab. And so they're in class and lab somewhere between 30 and 35 hours per week. They spend a lot of time in anatomy and physiology. First year they would take microbiology, histology, neurology, and then they get some clinical skills. They learn some communication skills as well as some clinical reasoning. And that's the way our curriculum has been to this point. We do have a revised curriculum that'll be starting this August, which is very similar to what I just told you, with more time spent in some hands-on clinical associated laboratories.
Right. 30 to 35 hours, that's almost a full work week there. That's quite some time.
Yes. And that information about our curriculum is actually on our website.
Oh, wonderful. Our listeners can actually find this link in the description for this episode of the podcast. So, other than the fact that it's the only veterinary school in Texas, can you tell us what makes that campus unique?
Okay, so this is Dr. Gwen Levine. We are focused on emphasizing the knowledge and skills that students will need to be successful on their first day of becoming a veterinarian and giving them the tools to continue to be successful every day after that. So we have faculty who are committed to students and their development as future professionals and also their wellness as well. And we're working on developing meaningful hands-on experiences to give students the confidence they need to go out and practice as veterinarians.
Would you tell us a little bit about how some of those experiences come into play in the curriculum?
We've been investing in with cadaver labs to have dog cadavers so that students can get opportunities to practice on very realistic models. We have also expanded into 3D modeling so students can explore the canine heart in 3D and understand better the path of blood through it. We have faculty who are always working to refine the curriculum and develop novel teaching approaches to encourage student engagement so they're not just sitting there and lecture, they're actually participating and gaining knowledge during that time. And then we have lots of animal experiences here. We're very lucky at Texas A&M.
Yeah, and really the centralized location really puts it right in the heart of some of the most densely populated areas of Texas, with Houston, Dallas, and San Antonio being, just about equal distance from each other in relationship to the Bryan-College Station region.
Mm-hmm.
Something I'm curious about is, obviously with veterinary medicine, it's different in that we want to make sure that our veterinarians are actually being exposed to as many different samples of what they might experience in practice. So how is it that students are exposed to not just, canine or small animal, but also with larger animals? How is it that they get that experience in the veterinary school?
What we do is we start that from the very first year of the curriculum, in that in the fall, students have small animal anatomy, and then in the spring, it's exclusively large animal anatomy. And then there has to be a lot of comparative teaching so that when students are learning physiology, they're not just learning about small animals, they're also learning about large animals. And as an example would be digestive physiology is considerably different in some of the different large animals. So they're taught that as well. And then we design experiences, live animal experience and simulation experiences so that students get the idea of what it's like to work with the different large animals, whether it's a ruminant or a monogastric. And then when students are fourth year, students in the clinic, they rotate through the small animal hospital as well as the large animal hospital. And in the large animal hospital, there's the equine services, and then there's food animal services. So they get, they get a differing exposure to large animals depending upon what their future goals are.
How is it that a student can kind of customize their experience so that they're prepared, they're better equipped for whichever area of veterinary medicine they'd like to pursue?
So we have been, for fourth year, we have been expanding the alternative track, which is something where students can kind of customize their experiences during fourth year. So students who are interested in epidemiology, public health, or perhaps anatomic pathology can travel to other veterinary schools, or we have students that get to go to the CDC on experiences.
Oh, wow.
We also have a food animal track during fourth year that allows students to travel out to West Texas and work at feedlots and get that kind of experience. So it can be very helpful, and students have a lot of flexibility.
That's really great to know.
They have that flexibility, and it's still important to realize that every student here has to take the North American Veterinary Licensing exam, which really covers all species. So they all have to have that same base of knowledge.
We have some clinical rotations in the fourth year where students do we call it the prison rotation. And this vet school provides quite a bit of the veterinary services for TDCJ. And when those students go on those experiences, they might be working with dogs, some of the dogs that are used to hunt the prisoners, tracking dogs, and they might be working with the cattle that the prisoners use to help provide their food and their milk, so students get a variety of experiences. In the fourth year, they also rotate through the Houston SPCA, and there they see a huge variety of species.
I bet. Well, that's really fantastic how, because veterinary medicine it can be so broad, that students are able to take advantage of several different resources within that campus that really expose them to a lot of different aspects of veterinary medicine.
Yeah.
Coming back to asking a question about where you all came from, would you mind sharing with us why you decided to come to the Bryan-College Station area to work at the College of Veterinary Medicine?
Okay. One of the reasons we like students to have a variety of animal experiences before they get into vet school is because when they're in vet school, no matter what their future goals are, they're still going to have to work with a variety of different animal species. And so we prefer that they have experience with a variety of species because it makes their educational experience much better.
That's an excellent point that you bring up. Would you mind telling us a little bit more about what kind of robust experiences an applicant should have if they're applying to the College of Veterinary Medicine?
Well, we'd like students to have as much animal experience as possible before they get into vet school, because it helps if you understand what normal is before you can understand what abnormal is. If you have never touched a cow and you have no goal of ever working on cattle, it's still good if you have a little experience with them, because you are going to work with them as a student. And it makes them a lot less scary if you have some experience with them.
I appreciate that clarification. Surely you get that question a lot, so I'm hoping that in answering the question here on the podcast, a lot of the future applicants will be able to know what to expect in the process. We're interested in finding out a little bit more about what the selection committee looks for in applicants and in deciding who they'd like to invite to interview.
Well, I would say that we give some information about this on our website, and we try to give an explanation of the different percentages that come from, for example, grades and the percentage that the GRE contributes to the overall package from the student. So we need people that are that do well academically, that have proven themselves in college that they can successfully pass the prerequisites that we require. And we're looking for people that have proven their abilities on the GRE. So the higher a student scores on the GRE, the more points they get within our point system. Students have to have a certain minimum number of hours of veterinary experience, and the minimum number is 100. But 100 is really just the bottom barrier for the number of hours. We'd like a student to have, for example, more than 600 hours of veterinary experience, because it makes them a better vet student, it makes them a better veterinarian, and it just makes them better prepared. We require animal experience, as we've already talked about. We judge an applicant's package for their leadership experiences, their community involvement, their volunteering experiences. We look at their evaluations that have been submitted, and then we look at their personal narrative or their personal statement.
This is Dr. Gwen Levine. We also want to see that students have committed to different experiences or activities over time so that they can develop roles in leadership of an organization perhaps, or have a commitment to hobbies and things that would make them a well-rounded individual and better prepared to take on the curriculum that is veterinary medicine. We also like them to have kind of a breadth of experiences in veterinary medicine just because the profession is so broad, but we also want them to have meaningful experiences in there. So they don't have to be a mile wide and an inch deep, but they don't also have to be just an inch wide and a mile deep. We kind of want a balance between the two. A research experience is okay. Ambulatory practice is okay. We're looking for students who have thought deeply about what they want to do with their future and have been gathering information.
We reward students that have taken honors classes, so that's always a bonus. We like it if students have completed their prerequisites at the time of application. It's not required that they be completed. There's requirements that they be completely finished by the spring before they were to gain admission, but it's definitely a plus for all the prereqs to have already been out of the way by the time they apply. We're looking for students that are good communicators, for students that have some life experience, that have proven we're looking for students that have proven not only that they are good academically, but that they can balance many things all at the same time and that they have resiliency in doing so. Because vet school is really, it's hard, it's voluminous, as I tell people, it's a lot of hours, and one has to be living life all at the same time. And so student needs to be able to balance all the things that typically happen in life as well as a very rigorous curriculum.
Thank you very much for sharing all that. I do have a quick question about the interview. I see that your admissions formula weighs the interview at 21%. And I do know that you all use the MMIs, the multiple mini interviews. Can you tell us what advice you have for applicants to prepare for an MMI?
So applicants need to practice just communicating effectively and getting their thoughts together in an organized fashion for these different scenarios. There are practice scenarios online. It can also help for an applicant to have someone record them or videotape them while they're working through these practice interviews. And there's an organization here on campus at Texas A&M, the Animal Science Department or Pre-Veterinary Society. They do put on mock multiple mini interviews in the fall for their students.
And I think most colleges and universities that have an advisor for the health professions will be able to provide good feedback in mock interview setting. But I was just interested to see if there was anything different that you all might be looking into that might be pertinent specifically to veterinary applicants.
Well, this is Dr. Blue McClendon. I agree with Dr. Levine in that the best thing students can do is read every single thing they can on the internet about MMIs. You know, they've been used in medical schools for a number of years, so there's all types of scenarios that students can read about. Students should read strategies on answering the MMI questions. And then there's actually a couple websites where they have practice MMIs. And I think one of the things a student could do is put themselves in the mindset of doing the MMIs. And then when they do those practice MMIs, they should actually time themselves according to the typical timing that they will read about. In other words, they have a couple of minutes to read the scenario, gather their thoughts, and then somewhere between 5 and 8 minutes to then answer the scenario. And students need to one of the first things a student should do with an MMI when they come to the scenario is they should think, what is being asked in that interview? Are they trying to look at ethical reasoning? Are they looking at compassion? Just as an example.
And that's very typical of any mock interviews. But I think with the MMI, it's on the onus is on the student to make sure that they can communicate clearly and make sure that they're addressing the question at hand. So I'm very glad that you all brought up the many resources that there are available, even outside of a typical advising situation, just online, that applicants can use to prepare for an MMI. All right, well, moving on to our final question that we have for you all. I'm sure you've all experienced this in several ways, of many different misconceptions that people have of veterinary admissions or veterinary school. I'd like to offer you all the opportunity to address a common myth that you all hear and provide the correct advice for our applicants out there.
I guess one myth I've heard is that you need to be an animal science major in order to gain admission into veterinary school, and that's not, your major does not matter as long as you have the prerequisites completed. So you can be a history major or an English major. As long as you have all these science prerequisites, you'll be good to go.
One of the myths out there is that if a student made a C in a course, that they should repeat that course. And I think that is a myth and doesn't necessarily need to be done. If a student made a C in a course, they should, if they really want to learn that subject more, they should retake that course, maybe take a course that's similar to it, or instead take a course that's going to give them some good experience or somehow will further their career.
But a C is still acceptable as a prerequisite course.
It is. Mm-hmm. It's not ideal, but it is still considered to be acceptable.
Yeah, and I do want to reiterate that the way that GPAs are calculated, every attempt at a course is taken into consideration by all of the schools. And so even if a student received a C on the first attempt in a course and then later on went and earned an A, we still keep that C in consideration in addition to the A to calculate their GPA.
Correct, yes.
So, you could take a class as many times as you want, but all of the attempts will be used in consideration for a GPA.
Yes. Mm-hmm. I think Yolanda probably, because she talks to lots of students, I bet she has a number of myths that she could talk about.
Oh, I'm sure she does.
Yes, this is Yolanda. And just one of the myths that I've recently heard about was in regards to where the prerequisites can be taken. Some students have heard that they can only take it at a four-year college university. Well, that's not true. The students can take their prerequisites at any accredited institution, whether it be a community college or four-year institution, with the exception of 4 prerequisite courses. So a student can take the prerequisites anywhere, again, with the exception of the 4 classes that can't be taken at a community college level, and those being the genetics course, the animal nutrition course, the biochemistry course, and the statistics course. Those 4 courses have to be taken at a 4-year institution, but any of the other prerequisite courses can be taken at a community college level. And again, as long as they're taking the correct courses, they'll be transferable to the DVM program prerequisites.
That is definitely some great advice for applicants, especially, a lot of times we're finding that students are not going to a 4-year university right out of high school. They're going to community college or they're going to a junior college, and they're taking some of these prerequisite courses there. So it's very, very beneficial to clear the air on that issue.
Yeah.
What other myths, Yolanda?
Another one is, do you have to have a bachelor's degree in order to get into the DVM program here at Texas A&M? And no, you don't. You just have to have the specified prerequisite courses. So in some cases, some students do enter our program without gaining their bachelor's degree. But in some cases, being that we are, yes, the only vet school in the state of Texas, unfortunately, we can't seat every applicant in our program, every year. And so some students do enter the program without that bachelor's degree, but then there are those students who don't get in right away. And so they eventually pursue and do gain their bachelor's degree. And so, again, some students get in on their first application, but then there's that student who may not get in on their first try and they have to apply again. So those students eventually do gain their bachelor's degree. So that is, something that they do eventually gain their bachelor's for those students.
Well, I do know that there's one myth that we get at the TMDSAS office that I would like to ask you all, and that has to do with where applicants should put in their experiences on the application. Would you mind addressing that?
It depends on what the experience is as to where it goes. If it is veterinary experience, it should go only under veterinary experience, even if it was through employment. So then the employment section they should state any employment that's not veterinary associated, that they haven't already stated in the veterinary experience section. Does that make sense?
Yes, it does. And we actually have a diagram that we point people to that depicts the exact same thing you just said. Well, before I let you all go, I wanted to offer you one final opportunity to, share any additional advice that you'd like to share with applicants for this year.
Okay, this is Dr. Blue McLendon. My advice is that if a student really wants to be a veterinarian, they should really go often to the admissions website here at the College of Veterinary Medicine. Things do change, so be sure that they check it from as early on as they think they want to be a veterinarian. They should also go to the AVMA website so that they can learn about veterinary medicine and learn about different specialties. They should seek as much knowledge as possible about this field, which is varied and exciting, and there's all kinds of different things to do. I think students should understand how rigorous it is and how hard it is going to be in vet school, and so that students are really sure that this is what they want to do. And then once a student decides that they really want to try to get admitted to vet school, they need to work as hard as possible. Once they start college, they need to be very focused on making really good grades so that they stand the best chance of getting into vet school. They need to get a lot of animal experience. They need to get a lot of veterinary experience. And again, just stay focused on their goals. What happens a lot of times is students will lose their focus when they first start college. They're away from home, less rules, and they need to really buckle down and maintain their self-discipline so that they don't lose their direction.
That's fantastic advice.
This is Dr. Levine. I would encourage applicants to keep in mind that Texas A&M does have the lowest debt-to-income ratio for graduates from our program in the country. So if you are a Texas resident, it would be awesome if you came here. And if you are not a Texas resident, you can still be in an advantage to come here over other places.
That's definitely something to tout.
Yeah.
People, any applicant looking at applying to veterinary school here at A&M, we welcome them to contact us directly so that they are given the best advice possible. As we said before, there are myths out there, and to get those myths clarified and exposed in whatever, they definitely want to reach out to us first and foremost, because we will give them the best possible advice there is with regards to our program here at A&M. And we'd be happy to speak with anyone with regards to our program and what we have to offer here.
Wonderful. Well, thank you all so much for taking the time to speak with applicants and for joining us on the podcast.
Thank you, Enrique, for doing the podcast. It's great.
Make sure you subscribe to our podcast on iTunes, Google Play, or wherever you listen to podcasts to stay up to date with us. Follow us on Facebook at facebook.com/TMDSAS and at Twitter at TMDSAS and at TMDSAS Support. On behalf of TMDSAS, we want to wish all our applicants for the 2018 cycle all the best of luck. Thank you very much for listening. We'll talk to you later.